Let's start off here with the general idea of what's being approved and how it was being approved. Generally, the FDA process is pretty long. You go through a process to try to determine not only whether the drug works, but whether it's also safe. Based on the speed of which this made it through the system, how confident are you in both of those two metrics?
Thanks, Romain, and it's great being with you today. We're very confident, and we think that the process that the FDA and the CDC has followed really struck the great balance between having a treatment and a vaccine that's available as quickly as possible, given the pace and the impact of the pandemic, as well as making sure it's safe. As we know, they waited 60 days after at least half of the participants had been in the process, and so that's almost 50,000 people between the two studies, making sure that it was safe. And the data that we've seen now, both from Pfizer and then starting today with Moderna, has shown an effectiveness of the vaccines that was really in excess of our expectations. We did not expect to see almost 90% or greater than 90% effectiveness. So on both accounts, we're very comfortable that these vaccines are a great next step and are safe.
Dr. Roth, from a distribution perspective, you're on the ground, you're seeing how Pfizer is being disseminated, the vaccine through your hospitals and senior care facilities. You're going to look at Moderna, which arguably is a little bit easier as it needs less freezing temperatures. But from your perspective, compared to other vaccines, how difficult is this to get into people's arms?
It's slightly more difficult, but it's not undoable. We've been preparing for this for months. We've known about the ultra cold chain requirements for Pfizer, and we've been preparing for that. And I think the work that Pfizer has done, and we've been in contact with them, as well as the FDA and the CDC, has made that process that we're going to be able to navigate very well and make this available not just for our own healthcare workers, but for the community. So we're prepared for that. I think we can make it work. It's not as hard as it seems. We just have to be thoughtful about the process, and I think we're very prepared for that. Obviously, the Moderna vaccine does not have that same degree of requirement. That will make it a little bit easier, but I think we're prepared, and we'll make sure that we can get vaccines to people, because this is the beginning of the end of the pandemic, and that's the most important thing.
Dr. Roth, I mentioned at the top of this segment New York and California, where the issue is hospitalization capacity that is really on the brink. How is Trinity Health doing in terms of capacity? Where do your hospitals stand right now?
So it's a difficult time. There's no doubt about that, both across the country and for Trinity Health. And the irony, right, of facing this highest surge yet. So we are at a peak of the number of hospitalized patients with COVID that we've seen yet in the last couple of weeks. We've hit that peak, and that has created a significant strain for us, and in particular our care providers. And so we're managing it, but I will admit it is a significant strain, especially for caregivers who have been going at this for 9 months. And so it does have an impact on our ability to provide services in some locations outside of COVID, which we don't want to do, because we know that it has a broader health impact as well. But we work hard to be able to maintain critical services for everybody. But it is not lost on us that while we're trying to roll out the vaccine, we are facing the highest impact of COVID in all of our communities across the country, and we have more than 2,000 people in our hospitals with COVID today.
So the impact is, by many measures right now, doctors, surpassing what we saw back in the spring, March, April or so. With regards to the preparation and the abilities of healthcare providers to deal with the influx of patients, and more importantly, to keep the death rate down, how much better or worse are we now than we were back in March?
So there are a number of things which are much better today compared to the spring, and that has made it doable because we are, as you point out, at a much higher level of hospitalized patients impacted by COVID today than we were even in April. But we know that that the treatments that have come to the fore over the course of the last few months, as well as our learning and healthcare is learning about how to better care for patients with COVID-19, have made a significant impact. We've seen our mortality rates decrease by more than half on patients who were admitted to the hospital, and our time in the hospital has also been cut by almost half as well. So that has made that burden more doable, and obviously, most importantly, better outcomes for people. And that's not to minimize the impact on these patients and their families, particularly the 3,000 people a day who are passing. But we are in a much better position.
Are you being able to vaccinate your own staff as quickly as you'd wish?
Well, I think we would love to have as many people vaccinated as quickly as possible. It was heartwarming, I will admit, on a personal basis, to see our nurses, ER nurses, and physicians and ICU nurses being vaccinated in a couple of our markets yesterday. And so it's heartwarming for us, and it's been a long time coming, and we know that's the beginning of the end. We obviously want to get this as quickly as possible. We know the process will take a little bit of time this week and over the course of the next few weeks in order for us to get to everybody. But we are ready to go and started even yesterday.
Dr. Roth, would you advocate for locking regions back down as an interim measure until more people can be vaccinated?
I think at this point in time, some of that varies by market, but I think what we have to do is do what we know works. And what we know works is masking, physical distancing, avoiding gatherings, both gatherings in small and large settings, and using hand hygiene. We know that those work. We have to do them as a country. We have to do them together and consistently. We know if we can do that, we think we can really put a dent in the number of cases, especially with the holidays coming up. That becomes a critically important part. So I don't know that we have a position on locking down as much as we want to make sure that everybody is doing those things that we know work, especially wearing masks.